The last decade has seen the emergence of India on the global map. But in the shadow of a shining India lies Bharat, a land plagued with diseases. Millions of Indians living in villages still don't have access to even basic healthcare facilities. And if India has to emerge as a superpower in all senses of the term, then it's essential that these challenges are addressed soon. So Kiran Mazumdar-Shaw, one of the leading names of the healthcare industry, sets out to find the solutions with a very special guest today.
Hello and welcome to India's Healthcare Challenge with me, Kiran Mazumdar-Shaw. My guest today is the very well-known Dr. Naresh Trehan, a great entrepreneur, a great surgeon who has created his own enterprise, Medanta Health City. Over the next 30 minutes, I will be speaking with Naresh and sharing some thoughts on how we can build a great healthcare system for our country. Naresh, thanks so much for coming on the show. And
my pleasure, no problem. Yeah.
Let me start by talking about the huge challenge we face in healthcare. Just starting with hospital infrastructure and hospital beds. We know that there is an estimate and a forecast given that we are short of 2 million hospital beds, and to build these 2 million hospital beds over the next 5 years, it's going to cost us $80 billion. I mean, those are the kind of numbers being thrown at us. We also know that 50% of hospital beds are in the private sector, and that private sector is actually spending almost 80% of every incremental dollar invested in the healthcare sector.
That's true. Mm.
So having said that, it almost seems to point at a picture where India's healthcare space will be supported by the private sector, and yet there are many people who are very worried about that happening, because they feel if that were to happen, then healthcare is going to be expensive, and how are we going to build an affordable healthcare model if we have to depend so largely on the private sector?
First, in India, why the burden of disease is so heavy at the ground level, at the rural level, at every level, is because the basics of health are missing. So you don't, that the whole story of no clean drinking water, sewage system, garbage disposal, mosquito control, education. These are the 5 pillars of a healthy country. So if we were to take our attention a little bit to that part of life also, and we just made sure in the next 5 years that every village had clean drinking water and had a sewage system and had proper mosquito control and education system.
So preventative health, it's almost that. Yeah.
It will decrease the disease burden by 50% at that level. Okay, and that is where the investment is the least and the return is the highest. Of course, this has to be done by the government. Private sector can help, and the civil society can help. Then comes, what are the needs where 75% of India lives? What are the needs of a village? The needs of a village is that, one, their daily disease pattern should be taken care of, so that if you get, say, dengue or malaria or cholera, whatever you're getting in the current environment, it does not lead to serious consequences. That means the diagnosis must be correct and early. I've been doing some study, and I've created a model in a district. It's a theoretical model which we are going to work now on, is to say, take a district. So we took Sonipat district. Sonipat district has a population of 22 lakhs. It has got 4 civil hospitals that belong to the government of Haryana. Each one of them is no more than 60 kilometers away from each other. If we took mobile systems and we attached them to these hospitals, which are in C-grade cities, where doctors and their families can very easily, safely live and go to have schooling and other facilities, then we take mobile systems which cover all this whole radius of 30 to 60 kilometers around them. It will take no more than 4 to 6 units per hospital. 4 to 6 doctors, 12 nurses, 12 technicians to be able to run So that what you are doing with the government's Asha scheme, with the cell phone availability everywhere, the mobile system goes, the patients are collected in one area, they are checked, treated. You must have ability to diagnose some of these things or take the blood back to the center and take the whether dengue serum and all that has to be done. Within 24 hours you have the diagnosis. If somebody has the problem, you send an ambulance and bring them to the district hospital. So you leave the primary and secondary care combined in one program at the state level, assisted by PPP models or NGO sector, wherever help can come. Then comes the tertiary care, which is the main challenge that we have in this country. This is where private sector can actually, if their intention was right, we can come up with workable solutions.
You know, you and Devi Shetty are both very, you're champions of health cities, the concept of health cities, which is really about, delivering healthcare for large numbers, for the masses, and therefore that's what sort of has inbuilt affordability in it.
Correct. So that's the model, that if you spread the cost over a larger base, you can offer it the highest quality at a reasonable cost. So that's basically, these are the models which we can keep refining.
In this special series, we aim to find out what it will take to build an all-inclusive healthcare system. And Dr. Trehan believes that the solution lies in developing a public-private model where the government should focus on providing primary healthcare. And this can be augured by private players providing high-end tertiary care. While Dr. Naresh Trehan is one of India's most famous cardiovascular surgeons, and over the past 2 decades, his efforts have saved hundreds of lives. But in his new avatar as an entrepreneur, Dr. Trehan is championing the cause of providing affordable and accessible healthcare in India. But the sheer numbers make it a daunting task, and he feels that the solution lies in combining modern-day medicine with traditional systems of cure.
Today, I think by and large, the public sector hospitals are under-resourced, whatever
and overloaded, might say. And overloaded. Yeah, because they are doing a great job, no question. If you take institutions like All India Institute and Safdarjung and all these institutions, PGI, the quality is very good, but they are so swamped with the load because the other facilities are not available. So I'm saying that because if we segment this sector and true to form try to solve the full chain from the bottom up, we will can have a robust healthcare system as we know it today in the next 5 to 10 years. But there is a very important element here which I would like to add. What we are doing today is we are copying the West in the practice of modern medicine. Personally, I believe, and that's Vedanta, the Medicity's message, the whole purpose of building it was to not only practice the highest end of medicine that is practiced anywhere in the world at affordable cost, but in progressively trying to bring in our traditional medicine, other forms of therapies, so that 3 things can be accomplished. One is that we can accomplish the same endpoints or outcomes as modern medicine or even better. We can do it with less pain and invasion of the body, and it should be imminently less costly, hopefully half the cost.
No, which brings me to another question. There are 2 aspects to all this. One is you're almost talking about our own version of personalized medicine.
Right,
okay?
absolutely.
The other aspect is, we all know that to really sort of bring in affordability into any system, you need standardization.
Correct.
So one of the things that we also have to address is standard of care, and that's something else I think we need to work on in the healthcare system to see how we can sort of
no question.
What
you are saying is, see, this is exactly what has to happen, that when you say that we need standardization, we need methods of administrating that standard. So first you set the standard, and then how do you monitor the standard. Now, good thing happened with NABH and the National Accreditation Board for Healthcare Facilities. I think it's a good start. Now, the only danger always is that can it be hijacked or get lost in the shuffle somewhere. So, we as participants in healthcare and knowing the fact that we need the standardization, have to keep an eye that we don't let standards of the administrating body deteriorate. And if we can do that, because you know NABH was created by us, by CII and India Healthcare Federation, and then presented to Quality Council of India so that they could administer it. And Quality Council of India has a good track record. So, I think if we stay with it, I think we have a good thing going for ourselves as far as standardization is concerned.
We have no other choice, because you know right now there is a huge question about why does treatment costs vary so dramatically from center to center, because there is no standardization. So, nobody can measure what any standard surgery can cost and what the standard deviation should be.
The process is underway, it is going to happen. But like I was saying, that unless the government's job is to create the framework under which healthcare can see the daylight in India, which it has not, because of the fact that we have given it stepmotherly treatment for the last 60 years. In the last few years, by effort of some providers, NGOs awakening, it has pushed the government, pushed the sector up in limelight, in the sense that now it is talked about. But I still see a lack of seamless policy to build the healthcare sector by the government, and it doesn't only have to be with the government, they should engage with the private sector, the organizations which can actually participate in at least writing the blueprint for how healthcare will roll out in India in the next 10 years.
No, you are right, because I think if we were to set up a task force, it cannot be just a governmental task force. It has to be a task force that is comprised of all the stakeholders, right from the hospitals to the insurance providers to all the sort of other stakeholders like the professionals who play such an important role.
But Kiran, one thing is very important, and this is what's disappointing again and again with India. These task forces are formed, studies are done. If you look at the amount of studies that are available, you could fill a small country with just the paperwork, but nothing sees the light of the day. Okay, so ultimately it is lack of leadership. So unless you have a champion who is willing to put things aside and say, this is my stream, I am going to lick this with the help of everybody. Like you said, task force led by dynamic people who will actually deliver, it will happen. See, one of the biggest complaints I have is that we still have not got that panic in us, that we are not that we can do it quickly, but the fact is we are going to make up for 60 years. How do you do that? If you are a marathon runner and you took a fall and you got left behind and you go back to your normal pace, you know where you will be, you will never catch up. So we have to do double time. That's the point is. Every meeting you go to say, okay, next meeting will be 3 months. 3 months, the whole 3 months,
the world will move on.
Why not tomorrow?
Yeah.
If we are 174th in the standard of healthcare out of 178 countries.
I know, it's crazy.
And we are 74th on the index of spending, right? We are late in healthcare, we are late in education. God's grace, everything has come into the forefront today. Now let's run with the ball. So let's look at it together. There is no government, there is no private sector, there is India. If we look at it that we are all part of the same marathon, we shall be able to run it better. And things are happening, but they are happening too slow. If I sound impatient, I am impatient.
Over the last decade, crucial policy matters like drug price control, regulations on clinical trials and fake drugs have seen very little government action, reflecting the general apathy towards a basic human right. It is ironical that the world's next superpower cannot even provide the most basic healthcare facility to millions living in its villages. Take a look at the numbers and you'll realize that the healthcare system in India is abysmal. Only 25% of India's population has access to modern medicine, and there's just one hospital to service every 1 lakh plus population in rural areas. The figures are appalling, and there is an urgent need to overhaul the entire system. So, what needs to be done?
You just mentioned about, look at the amount of catching up we have to do. If you look at our healthcare spend per person is in the vicinity of $30–35.
Correct.
You look at what the US is spending, which is the extreme, which is $7,500 per person. You look at a country like Cuba, that's spending $300 per person. And then if you look at other BRIC economies like Brazil and Turkey or China, they are all spending in that upward of 500 to 1,000 range. So I think there is a lot of catching up to do. Yeah. Right now, we are spending 1% of our GDP, at least the government is budgeting 1% of our GDP for healthcare. Simply not enough. Private sector, by the way, is actually accounting for 4% of GDP in healthcare. And the healthcare space is huge. Unless, as you say, we double our pace or even treble our pace, there's no way we can catch up.
I mean, when you start off on it, it seems that it's there, you can actually see it and you can make it happen. But then when you try to get there, it becomes elusive, and that's our dilemma. And I think that we need some dynamic people, leaders, role models to head this whole thing, give up themselves and say, healthcare sector in the next 5 years, we shall reform it in the following way. And there is a seamless agreement on it, state governments and national government. And believe me, people are sensing today, every politician is sensing that healthcare is going to become an issue in elections very soon.
It is already becoming an election kind of...
Where the appreciation was less, it is now sinking in. So I don't see a state government which is aloof to it. There are state governments who are also very willing. In fact, we are working on this PPP model with the Planning Commission. Montague may have told you about it. That we have this whole the CII Committee in India Healthcare Federation. We are doing this whole thing with PPP model to see how it can work. But again, what happens is that by the time you refine it, there is too much that argumentative Indian comes out of us all the time, and then we never. You have to. Americans have a great sort of phrase for it. They discuss intensely, and then say, "Let's go with what we have. We'll find out the rest later." Just say, "Okay, I've got the framework. Let's go. We'll reform the rules as we go along." So we don't sit on a table for months and years and say we cannot work out a simple PPP model. So, like I said, I'm a surgeon. I like quick solutions, especially where we have been left behind. And because of the fact that I wish for our country to be the best in the sense that you always fight for it.
But again, coming back to the fact that you mentioned you're a surgeon, we also know that there's a huge deficit we have in terms of just medical professionals, like doctors, like surgeons. I understand that the numbers are staggering. We are today short of 200,000 doctors. We are short
500,000. Actually, we only have half the number of doctors we have. We have half the nurses. The 1 million nurses, 750,000 or 800,000 nurses we have. We need another million. So, see, what am I saying? You know how long it takes? One bad part about India is that there is the intention is good of a law. 100 people and go and break that law. The government has to react and put restrictions. So it actually stymies the progress because some people have gone and abused it. And the government also is right that you can't let it be abused every day. The Medical Council of India is a prime example. So we are our own enemies in a way, but I don't know how we can override this, but there are good people in this country. If we hand them the ball to say run with it, I think they can. But the process sometimes of choosing the people who are going to be running with these things is also quite. I wish in the next 5 years we could change this whole scenario and be proud of our healthcare system. We can innovate, we can work hard, but we need the environment to tell us to do that. And the same people who may be laggard here go and outperform every American in the United States or every UK man. So I am telling you that we can do it. We just need to keep going and at it and try to keep, but like the issue comes back again, it must be affordable. Because if you leave large chunks of Indian population out of reach, then again you did the wrong thing.
Yeah, inclusive.
So if we can do that, if we can break it, and the government and the private sector should not say I'm private, I'm government, they say this is for India. And if we can solve our problems together, I think it will be fantastic.
Thanks a lot, Naresh. That was really, really good.
Thank you.